The other thing I want to ask you is that obviously anyone that goes into a rural setting, we know that mental health for doctors is always a touchy topic and it's always at the forefront. And mental health, we know, is poorer in doctors that go into a rural setting with higher rates of suicide and suicide attempts. How did your mental health cope with going rurally?
Yeah, great question, and yes, very topical. Yeah, those statistics are definitely real. For me personally, I have struggled with my mental health through training, definitely. I think though, in fact, my lowest point came during my hospital training years, and especially that last year of pediatrics in that very challenging environment and challenging department. And then I think it was compounded by the unfortunate coincidence that my first year of GP training was the year that COVID hit. And so, having come out of the hospital system, I think a lot of GP registrars will attest to this, starting GP feels like becoming an intern again. It's just so different, that system. It's not just like another rotation, it's just a completely different system. So that was difficult enough to deal with, and then COVID hit very early that year, and we were thrown in that clinic into doing a lot of respiratory clinics, and it was all a bit too much. So I'm not sure that it was the rurality of that situation that really got to me. But later on, yeah, definitely, I think the rural factors did come into play. So you are a lot more isolated geographically. Certainly for me, like I said, not having grown up rural and not having any of my friends or family in that rural community that I was working in did take its toll, and is a significant factor in me wanting to move back to Brisbane and now ultimately having done it. And unfortunately, in reality, means that I'm not going to stay in that rural community or possibly any rural community very long term unless I can bring a support network with me. So I think that's a massive factor in doctors' mental health. That unless, because we're like anyone, we have basic human needs the same as anyone else, and a big part of that is, that love and support around us. And so I think rural doctors would have a much better chance of thriving if they had that network around them rurally. That's just one factor. The others obviously are the unique demands of a rural job. Now, you mentioned specifically females. For me, the biggest difference that I can see is that female GPs in particular are expected to be a lot more empathetic, to do a lot more, like we take on a much greater burden of mental health care in our communities. We're expected to spend a lot more time with our patients, doing work that is usually a lot less remunerated than our male counterparts who, can do the shorter consults, can do more of the procedural skills, and those are naturally the higher billing items. So financially, we're worse off, and emotionally and mentally, massive burden. And unfortunately, that's the case with every single rural female doctor that I've spoken to, and also even the metropolitan female GPs that I speak to. There's definitely a gender gap there, like a big pay gap and an emotional burden gap, I think.
Yeah, there's a lot to unpack there, and I think you bring up this concept of intersectionality, which is this cross-section where we know that doctors going into the rural setting have a increased propensity of developing things like mental health disorders or mental health conditions, and then you got this also other subset of group being females that in the healthcare setting also have these disadvantages, and now you put that together and we don't have any data on what it's like to be a rural doctor who's also a female and what the impact of those two things are individually and combined on mental health. And then we also have other groups like being an Indigenous doctor in a rural setting who's also a female. Now you're putting on three things that are going to be all impacting, and how does that actually affect your mental health? The one thing I was really interested in when you were just talking about that was I think as doctors we're creatures of habit, and that's why most of us won't leave a hospital unless we have to leave a hospital. Whenever we have a new change, that's when the most likely stress is going to develop, and that's when we're going to be most vulnerable in terms of our mental health. For doctors that are doing, maybe interns that are doing their rural time, or rural generalists that are just planning to go to their first rural setting placement next year, what would be one tip that you would have that would have helped you or you learned along your way?
That's a tough one.
Because you mentioned support network, and I think that was really important.
Yeah.
But not everyone will have a good support network. Some people will be going there as single, some people will be going there with a family, some people will have a family and leave their family behind and just go by themselves, which is even more stressful. Did you find that you could build friendships within the community and separate the friendships between the community with your job as their GP?
Yeah. Great question. So I guess the first question to ask yourself there is, what is your intention with this community? Is this simply a 1-year training process that you're taking up and you know that you're going to leave at the end of this? In which case you'd approach it quite differently, right? You wouldn't be inclined to lay down as many roots. But if your ultimate goal was ideally to stay in this community and, become entrenched in this community, then I would highly encourage really getting to know the community and becoming involved in community events and really getting to know your co-workers and going to those social events outside work. If not for, so we talk a lot about this in rural medicine as being beneficial for your patients, because you get to know the community that you're working in and that they are living in, and you understand the rural context that you're doing your job in, but certainly for yourself, in that you feel accepted. And I think humans being such social creatures, this is a deep need that none of us can escape, is that need for belonging, for acceptance, for love, for being a part of a community and feeling like we belong there. And so if that is your goal, to belong to a community, for however long you're going to work there, then I think the biggest lesson is that you have to be the one to put in that effort. And the community will respond. Once they see that you're willing, people will respond. And rural people are so friendly, and they will welcome you into their homes. They're so generous. I think a lot of rural communities, unfortunately, have been burned by doctors who just come and go, and there's this endless, turnstile of doctors. And so if you have intent to stay, then make that known to your community, and they will embrace you with open arms.
It goes such against the mantra that we're taught in medical school. In medical school we're taught to keep our patients separate from our work, and we're told obviously not to treat our family members, not to self-medicate, not to do all these things that are just trying to keep your work and life separate. And you kind of just have to break that barrier and undo everything you've been taught in medical school in a nice way, to really lend yourself to be able to actually be embraced by the community. And if you don't, because it's the way we've been taught, you're going to get burnt out, and it's going to be really challenging, and the community is not going to respond to you, and then that's going to make it a perpetual cycle that just gets worse and worse and worse. And that's really tough. The other thing is that being a female in the community and being from a different ethnicity, you're from an Asian background, you're an attractive female who's single, did that pose its own unique challenges when you went into a rural setting?
Surprisingly, not as much as I thought it might, and that's pertaining to being an Asian female. I guess you know, in the back of my mind, and I think that might be the way with a lot of ethnic minorities, we do worry about how people would see us and whether, you know, we'd have to. I guess this is something that a lot of us are ingrained with as children, that you have to work extra hard to help people to accept you. And I don't know, maybe I was instinctively doing that, but I don't really think so. But it never became an issue.
Yeah.
You know, I can honestly say that I have not received a single racist remark, and I'm extremely grateful for that, and I love that that is the case now. Right, some people might make some comments that, you know, you might think, oh, well, you didn't really need to ask that or point out my ethnicity because it's irrelevant, but it's never, it's always done with goodwill, because what it actually is it comes from a place of curiosity and patients actually wanting to get to know you and actually wanting to relate to you. So once I realised that, it became actually even easier, because the goal is to connect to your patients, and like you said, to break down those barriers that we're taught to put up as doctors when we're, you know, in the early stages of our training, and you realise that a lot of these rules actually do not apply in real life and cannot apply in real life. And you start to see a side of people that I think really breaks down that cynicism. So I was really